Hi, my name is Anagha Thiagarajan, and I am a medical student at UC Irvine, and I am originally from the Bay Area. My research today is about analyzing comorbidities in rosacea patients. So what we did is we used TriNetX, which is a large nationwide database with de-identified patient data, to see if the risk of developing comorbidities varies between populations. Because skin of color is under-researched in dermatology, we decided to look into comorbidity differences between Black and African American populations versus non-Black and African American populations. And what we found was that Black and African American populations with rosacea are at significantly higher risk to develop various comorbidities, such as heart failure, lupus, cerebral infarction or stroke, or diabetes. They're also at higher risk to develop rosacea-related sequelae, such as rhinophyma or post-inflammatory hyperpigmentation. I think it was really surprising to see that Black and African American populations are at higher risk to develop type 2 diabetes or heart failure or other cardiovascular diseases. I think that rosacea has been linked to various comorbidities, but these are some new links that we've found through our study during TriNetX. I think some of the next steps for this research would be to look into mechanisms as to why this happens. There's various links between rosacea and chronic inflammation and development of comorbidities, so I think further looking into the pathogenesis of these comorbidities is really crucial, as well as improving diagnostic criteria for skin of color patients that have rosacea. I think oftentimes characteristic symptoms of rosacea, such as erythema or telangiectasias, can go unnoticed in darker skin tones, which might lead to a delay in diagnosis and chronic inflammation or rosacea-related sequelae. So I think it's really important for future research to look into things like that, and I definitely would love to be a part of it. I think some of the biggest challenges with this topic is that it's difficult with a database like TriNetX to really understand each patient's characteristics. For example, a database like that doesn't have characteristics like skin types, like the Fitzpatrick skin types. So I think it's important for future research in a prospective fashion to look into classifying patients by their skin type and then following them for a certain period of time to see how their outcomes differ from others.